Yeah, I'm surrounded now by men with prostate cancer and going through this journey, and what each of them says to me is, when the doctor says you've got prostate cancer, or just the word cancer, they really shut down and they can't remember what the doctor said beyond you've got prostate cancer, and they walk out of that room in shock. There's just a million thoughts go through your mind, some of which are around, am I going to survive this? And if I do survive this, what's going to happen? What treatment do I have to go through, and what is my life going to be like after treatment? A very common side effect of surgery and radiation is incontinence, impotence, bowel disorder, and with that comes just so much anxiety, depression, and it strikes at everything that we are truly as men.
It's not just about diagnosis. We need to remember that prostate cancer really is a long journey with many stages along the road.
Cancer treatment is all about the disease. Survivorship is about, what are you going to do now? How are you going to live your life? What's the meaning behind your life? And how do you embrace that, knowing full well you've just been through this really significant experience? How do you move forward?
We need to address matters like survivorship. We need to go out there and take hands with survivors to support them through this very big challenge called cancer.
Movember is now one of the major funders of prostate cancer programs throughout the world. We see great programs going on in one part of the world, and we know that other parts could benefit from that. So the aim of this summit is to bring all our men's health partners together so that they can learn from each other and go back and deliver the very best service to men and their families going through the prostate cancer journey.
What I'm doing here at the summit is learning about a lot of enormous important work going on in other countries than the United States about how to improve the survivorship, how to improve every day for a patient with prostate cancer, regardless of stage.
We're trying to address a legacy of neglect for prostate cancer. There have been too many years where this disease has not been talked about.
It's communication. It's talking about the disease, a disease that men were very reluctant to do so just a very short time ago.
And one of the things that is coming out of this collaboration, and I suppose going forward, is that we'll begin to develop an approach, perspectives, strategies, priority issues that we can build a collaborated a program moving forward.
It's great to feel that you're part of something bigger than just a small country like New Zealand. It's going to provide much better outcomes for our country, and I hope some of the ideas that we have been able to put into the mix here might help in some other part of the world.
The issues for men with prostate cancer in Ireland are very similar to the issues in other parts of the world. And through the work of Movember, we can meet and work together and learn about each other's programs and take them back home and put them into practice.
People have flown from South Africa and Ireland and Canada and Australia and New Zealand to be here in Los Angeles to work on this problem together and ultimately deliver a much greater level of service to men and their families going through the prostate cancer journey.